Hi friends, today we are going to speak about PCOS. Why does PCOS happen? What do you do about it? Can it be cured? How can you control it? I think these are the questions which are troubling a lot of women. You know, I've been in practice for more than about 30 years, and now what I've realized is that earlier there were hardly any cases of PCOS. In fact, when we were students, our textbook had just one paragraph, a mention of PCOS, that this is a syndrome which was described by Steen and Leventhal in the year so and so. That was all we knew, that you have polycystic ovaries and you have some extra hair growth, etc. That's it. And later on, as time went by, as the decades have gone, we have realized that we are seeing so much of PCO today in our country. Almost 20% of women have PCO, and the numbers are rising even today. So what is this PCO? What is this epidemic that we are seeing of PCO today, and why? I think the first thing that women ask me when they have PCO is, why did this happen to me? This is a question. It is a lifestyle disease. It is an endocrinological and metabolic problem. Now, what do you mean by that? Endocrinological means hormonal, means it has to do with hormones. Our body has many systems. Hormones are chemicals which are produced in our body, which produce various effects. Now, because hormones are released in the body and they go into the entire system, they affect the entire body. In our body, there are thousands and thousands of hormones, mini hormones, chemicals at every level, at every cellular level. We have chemicals which are communicating with each other. So one part of the body knows what the other is doing, so they coordinate with each other and things go smoothly. And our body is connected and aligned with nature, with the circadian rhythm, that is with the diurnal variations, that is day and night. So as the sun rises and sets, with the cycle of the moon, we are all, our hormones, we are aligned with nature. Now what has happened in the last few years, we have disrupted this cycle completely. We sleep when it is day, we get up when it is late in the day, when the sun is shining right up. We are not sure about our meal timings. Our lifestyle has become very erratic. That is possible, one of the reasons that PCO-like diseases have happened, because the hormones have gone completely haywire. The hormones don't know when to get released. They don't know when she's going to eat next. They don't know when she's going to sleep. When they know that the sun is up, they are supposed to be raging and making her active. That time she's asleep. So there is a lot of disturbance in our lifestyle. So we need to, ladies, correct our lifestyle if we are going to get rid of diseases such as PCO. Now, a lot of you may be suffering from pimples or hair growth around the chin or the beard area or the mustache area or on the chest or on the abdomen, and that is one of the features of PCO. Now, PCO has many features which are possible. Many times, you know, there's a question you have that whether I have PCO or not. Some doctor has said this is PCO, ultrasound has said this is PCO, but is this PCO? So you have one of the features, like I said, is acne and hirsutism, which means hair growth and pimples. The second feature is an ultrasound picture which says that yes, your ovaries are having multiple cysts, or what is known as polycystic ovaries. So are these cysts tumors? Do they need to be removed? No. These are not tumors. Cyst means what? It means a fluid filled bag. Normally our ovaries produce eggs, and each egg is a fluid filled small bag. It does not exceed usually more than 20 to 25 millimeters. But in polycystic ovaries, what happens is that every month that egg which grows and it is supposed to rupture, that ovulation, which I'm sure all of you know about, that does not happen regularly, because again, hormonal disruption. Because of that, the ovaries are not producing eggs regularly. So small little eggs go on collecting inside the ovaries, and these form little cysts, and that is why the ovary becomes bigger, and that is known as polycystic ovaries. So your ultrasound may show a polycystic ovarian appearance because of this hormonal imbalance. But there is a catch here. There are certain age groups, such as the adolescent age group, young girls. These girls are naturally having more eggs, because when you are younger, your ovaries do have more eggs. That is why their ovaries do look bigger and they may look polycystic in appearance, although there is no polycystic ovarian syndrome. So if you are maybe less than 18 and your ovaries are showing on ultrasound a polycystic appearance, and otherwise you have no problem, your periods are regular, you don't have any pimples or you have very few pimples, and you are perfectly fine otherwise, then you don't have polycystic ovaries, okay? Or if you have any doubts, go and meet your gynac. Just because the ultrasonography is saying that polycystic ovarian morphology, please don't assume that you have PCO. Don't cry about it. Please go and clarify your doubt with your gynecologist. So that is the other thing. Now, one very, very important common feature that we see with PCO is weight gain. And let's say PCO is not just the cause of weight gain, it is also the effect of it. So these are things which are interdependent. So you put on weight, and because of that you get hormonal disruption, and because of that the PCO develops or worsens. At the same time, because there is PCO, there is hormonal disruption, and that prevents you from losing weight, or it makes you put on more weight. So that cycle needs to be broken, and for that you need to lose weight. Somewhere you need to attack that cycle, and you need to separate out the PCO from the weight. So you need to go on a weight loss regimen. Very, very important aspect of PCO. Now, it does not mean that women who are thin are never going to get PCO. There are women who do develop PCO in spite of having normal weight. But women who are overweight, once you lose weight, the chances that your PCO will get better is very, very high. One of the most important features of PCO is irregular periods, and that is usually very delayed periods, because you're not ovulating on time, so you are not going to get your period on time. You may get your periods maybe every few months, every 2 to 3 months, or slightly delayed. Some women can also have regular periods in spite of PCO. Okay, so again, none of these features is by itself, sine qua non of PCOS, that if you don't have it, you don't have PCO. It is a combined, it's a big picture, it's a combination of various systems which get affected in the process. So we need to see the doctor. The doctor is going to decide whether you have a PCO. PCO is again a spectrum. Spectrum meaning there are mild varieties and there is a very severe case. The severe case would have almost all the features. Maybe she's overweight, maybe she's got acne, she's got hair loss, she's got hair growth on the beard and chin area or chest. She's also not having regular periods. She's getting very, very delayed periods. She may be having periods only if she takes medicines. She may be having trouble conceiving. Okay, and she may be having abnormal cholesterol levels. She may have developed diabetes because of PCO, or high blood pressure because of it. These are features which can also happen. So because of these complications of PCO which are possible, that is high blood pressure, diabetes, high cholesterol levels, and even in the long run, for very, very uncontrolled cases, swelling of the lining of the uterus, the endometrium, which may ultimately even lead to endometrial cancer in rare cases. So we need to take care of our health right from day one. We need to control this process. So what is the solution? We've discussed the problem. I know by now everybody is very depressed, but like any other problem, this is not something which cannot be managed. It is not, we cannot really call it curable, but I want to tell you this, that I have in my practice seen a lot of women who have become completely alright. Women who have changed their lifestyles, women who have come around, who have lost weight, who have decided that yes, my health is a priority, and they take care of their health. They get up early, they have a proper breakfast, they have a proper lunch on time, they have regulated their meals, they have regulated their sleep hours, they sleep early, they do a healthy, they eat healthy, they have regular exercise. These women, they have overcome PCO to a large extent. I have seen a lot of women, when they eat healthy, sleep healthy, lose weight, their periods become regular. Then again they put on weight, again their periods become irregular. There are also women who try their best and still their cycles do not become regular. Yes, this is also possible. So you take medicines and everything and you say, oh God, doctor, every time I take medicines, my periods are okay. The moment I stop the medicines, I'm back to normal. Yes, that does happen. And nobody can guarantee that once we stop the medicines, your periods are going to be regular. But yes, if you do have a healthy lifestyle, there is a good chance that your periods can come back to normal, and you may even go off medicines also. But if you don't do, I mean, what is wrong with having a healthy lifestyle? It's only going to benefit you. You are going to decrease your risk of diabetes and high blood pressure and cholesterol, which you would have had otherwise. So you definitely need to eat healthy and stay healthy. So PCOS is not something which is a curse. It is not something which cannot be taken care of. Whether it is your fertility problem, you have trouble conceiving, that also can be treated. You have clinics, you have medicines, we can make you ovulate. So everything can be taken care of. You just need to take good care of yourself. You need to prioritize your health, and you need to decide that yes, I may have had or I may have PCO today, but I am going to make sure that I live a good life, and I will take a few medicines if required once in a while. But if you really control the process well, you may revert to normal, or if not, at least you will still lead a very good healthy life with a few occasional medicines. So PCO is not something to worry about. Artisan's foundation is dedicated to environment. It is also obviously dedicated to humanity. So what better than helping women? So we have taken the initiative of helping women use the menstrual cup, as you all know. The menstrual cup is something which is very, very healthy, very, very comfortable, and absolutely harmless to the woman. It makes your life so easy, gives you so much freedom. So PCO management is also one of the tools to help women lead better lives. So at Artisans, please join our foundation, please join our cause. The link is given in the description below. You can subscribe and you can join the foundation. You can share your experiences. You can also share with us how you would like to connect with us, so that you can help us also help women, help the environment. We are going to be taking up many more new causes in the near future, and we would love all of you to connect with us in whichever way you can.